Community health assessments have an identity crisis. Because public health is so broad and overlaps multiple industries, everyone uses different names for essentially the same thing, understanding the status of their community's health. This confusion keeps organizations from getting the strategic insight they need. Let's talk about it. You're listening to the PHEC podcast, episode 413. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations, community health foundations, and government agencies. This episode is going to be a little different. I'm going to do a deep dive on a service and a topic that I speak and touch on multiple times across different episodes, but I'm going to do a deep dive here. And it's about community health assessments. I believe we have a bit of an identity crisis when it comes to community health assessments. Now, I'd like for you to also think about the interdisciplinary nature, the multiple industries that public health overlaps, because public health is so broad. We know this. I also want you to keep in mind that we, as public health folks, have our own little language, and we kind of stay siloed sometimes. Unfortunately, that's the case. We're trying to work on that, right? We're trying to break out of these silos. But it's easy for people, and it's not just unique to public health. You get into an industry, you get with your peers in a certain niche, and you have your own little language. Well, this poses a real problem and a challenge. And community assessments is something that my company, that we have really provided that service to a variety of industries and in different settings. So our perspective is a little different, and I see things that maybe others would not see the same way because of our multidisciplinary team structure, just the lens of which we view things, and my background as well. So let's dive into this a bit to better understand community health assessments. Community health assessments represent the foundation of effective, data-driven public health action. I think we can all agree on that. We specialize at my organization, my firm, we specialize in transforming complex community data into clear, actionable insights that empower communities to make meaningful change in populations they serve. You've heard me say that multiple times, and you're going to understand, hopefully, in the next few moments, why this is so important. And maybe you can take some of this and apply it in the work that you do as well. What are community health assessments? Now, I think everyone listening to this has their own understanding of that. If you're listening to this podcast, the majority of you are public health trained, or you're close enough and you're interested enough that you understand community health assessments. But what I really want to do is peel it back a few layers just to kind of get to the core of what it really means, and not necessarily some of the titles and labels that have been associated. A community health assessment is a systematic process of identifying and analyzing the health, strengths, assets, needs, and challenges within a specific community. Now, rather than making assumptions about what a community needs, these assessments provide us with evidence-based insights that guide strategic decision-making and resource allocation when it's done properly and when it's done well. Think of it as getting a comprehensive health pulse check on your community. We're able to understand not just what problems exist, but also what's working well. That's equally important. and what opportunities exist for improvement. So it goes by many names, but they all have the same purpose. So one of the challenges in this field, of course, like I said earlier, considering the overlap with multiple industries is that community health assessments go by different names depending on the industry and the context, but they all serve the same fundamental purpose. Okay, so our epidemiological expertise allows us to navigate these different approaches rather seamlessly. But I do want to highlight, and I think I'm going to follow my notes to make sure I stay on track here. So I have 5 that I'm going to share with you. The first one is what you are probably all the most familiar with, and that's community health needs assessments. It's required for hospitals every 3 years. These assessments help healthcare systems understand the specific needs of their service areas, which can differ from hospital system to hospital system and across different metropolitan areas or rural settings as well. So whether it's identifying gaps in services for populations with chronic diseases like diabetes or heart disease, or understanding rural versus urban health challenges, these assessments ensure that hospitals are meeting their community's actual needs. So the community health needs assessments serve as the foundation for strategic planning, for resource allocation, and for community benefit programs that hospitals must demonstrate to maintain their tax-exempt status. So it is a requirement. You may feel like, okay, well, the hospitals have to check the boxes. Well, there's some structure in place there. It's more than just checking boxes. And organizations around the hospital service area will often use those assessments to help decide what programs what they're going to fill, because it's addressing the needs of that community in that service area. So for those other organizations that are within that same service area serving the same community, it's a very important tool, resource, and it's extremely valuable, like I said, into allocating, knowing what's working well, what the strengths are, where there's opportunity to collaborate. These organizations within the same service area can then collaborate to serve the community. It could be an extremely valuable resource when it's done well, and it's an exciting project to work on. Another example is community health profiles. Now, community health profiles are a compilation of data that describes the health status of a specific community, including demographic characteristics, health indicators, and available resources. They act as a detailed snapshot that identify the health disparities and guide to decision-making for health improvement plans. Now, we're currently developing these for urban Indian populations right now, using publicly available data and some specifically protected data sets that ensure accurate representation of underserved communities. It's a strengths-based approach that we use in this setting and with this particular organization, and it serves multiple other urban Indian organizations. So much like that community health needs assessment for the hospital will serve that all the communities within that service area, and those other organizations may use that as well. Well, this community health profile for this population I'm describing for Native Americans that are within urban settings is also used by other urban serving organizations within that same region, in that same service area. So they are slightly different approaches, but essentially serving to provide that information, that detailed information about the strengths and opportunities within those communities that are part of this profile. These profiles also highlight the differences in health outcomes between different groups and support community engagement by helping populations understand their own health status. When both of these are done well, they're involving the community members in the process so that the community that is being served, all the stakeholders are at the table to have a say in what indicators are important in the case of the community health profiles. It's not just the researcher deciding what they think is important for the community, but the community is involved to say what is important to them as well. Let me give you another example that you may not have thought about really as a community health assessment, but it is. And that's a landscape analysis. These comprehensive environmental assessments map the broader dynamics surrounding specific health issues. They involve identifying key stakeholders, evaluating available resources, analyzing strengths and challenges, and recognizing trends to inform interventions and policy development. Now, we conducted one for South Carolina's Department of Public Health, and it's systematically assessing organizations' readiness. Like they wanted to know around the area which organizations were ready, which were already using resources, and what the barriers were to implementation and the stakeholder interest in. And it was all centered around community health worker programs. So before allocating resources and significant funding, they wanted to know what the organizations around the area, the region, were already using using community health workers, if they were interested, if they were ready, if they had existing resources, or what their barriers were. They needed to know they needed this information about the community before they made this investment in funding so they knew where to invest. So this holistic approach enabled informed decision making about program design and partnership opportunities. And then let me give you another. We're going to do 5. So I've given you 3 so far. The 4th one is a SWOT analysis. So this is a time and tested strategy. It's a planning tool where you systematically evaluate an organization's internal strengths and weaknesses alongside external opportunities and threats. So in the health context, a SWOT analysis helps organizations understand their capabilities and environmental factors to develop informed strategies. Whether assessing organizational capacity for new program implementation or evaluating competitive positioning in healthcare markets. So these analyses provide structured frameworks for strategic decision making. So this is number 4. So let me give you one more. Number 5 is going to be patient population estimates. You may not have really thought about this. This is a crucial forecasting tool where you determine the number of people in a specific population or group who are likely to be affected by a particular disease or condition or healthcare intervention. So it's defined by demographics, health conditions, geographic location. These estimates enable healthcare providers, researchers, policymakers, and to plan resources and predict healthcare needs and evaluate intervention impacts. So used extensively in the pharmaceutical industry and healthcare planning, these forecast-oriented assessments help organizations understand the current and projected health needs across different demographics and geographic areas. Often spanning like 10-year forecast is a common time frame, depending on the ability and the methodology, of course. It's an incredibly important tool. For example, I'll use diabetes. If we want to know the prevalence of a population that has diabetes in a particular geographic area, maybe compared to some other geographic areas, and then we can get that snapshot of the prevalence, so how many people have the disease, and then a forecast of how many we anticipate having that disease in 3 years, 5 years, 10 years, for example. That's extremely important in terms of intervention, in terms of drug development, in terms of treatment, investment, because often the investment and treatment plans and pharmaceuticals is a very long process. I don't want to get too far down a rabbit trail. I just want to give you these examples. So patient population estimates is another example of a community health assessment. So again, 5 of these: the community needs assessments, community health profiles, landscape analyses, SWOT analyses, and patient population estimates. All examples of assessing the needs of the communities being served. And depending on the organization, the client, the need, the industry that's overlapping public health will determine which one of these assessments. The client doesn't always, or the organization doesn't always know exactly what they need, but oftentimes they do because they've been, doing the same types of assessments over and over. But sometimes they're not really sure what type of assessment is the best. But let me dive a little bit more into why community assessments matter. There are multiple critical functions that I can raise in terms of why they matter. And just for the record, the 5 that I shared with you are not the only examples. Those are just the most common ones that we see and that we've worked with our clients on. So some of the multiple functions, let's see if we can narrow this down. The first one that I'll share with you is funding and grant writing. Assessments provide the evidence needed for successful grant applications and funding requests. They demonstrate clear community need and organizational readiness. So, this is a very important tool for effective funding and grant writing. The second critical function I would mention here would be program development. Rather than creating programs in isolation, assessments ensure that new initiatives address actual community priorities and build on existing strengths. Another really important function is resource allocation. As I've mentioned a few times, organizations can invest their limited resources more effectively when they understand what's working, what's missing, and what their community values most. Another function is stakeholder alignment. Assessments bring diverse community voices together, creating shared understanding and collaborative momentum for change. That one I really especially like. I think a lot of you are the same. And I'll mention one more critical function here of why community health assessments matter, and that is continuous improvement. Regular assessments help organizations track progress over time and adapt their approaches based on the ongoing changing community needs. Now, you can probably tell by now, you can probably hear in my voice why I love this niche area so much. I feel like for our organization, it allows us to really feel that we can almost touch the impact that we're having when we're able to get involved and generate an assessment, and turn that over to our client and know that that's having an impact on not just our clients' use, but the other organizations who will then also use that to drive their organization decisions and ultimately better serve the community. I will take a moment and brag just a little bit, just differentiating what sets us apart. I think our advantage and what we bring to the table that makes us unique. So we are bringing over 25 years of combined experience across healthcare and public health with diverse skill sets that span interdisciplinary platforms. And that enables us to navigate data challenges. We understand that publicly available data often doesn't adequately represent diverse racial and cultural populations or specific community groups. We use advanced methodologies to ensure assessments truly reflect the communities being served. Another differentiator is choosing the right approach. We determine whether qualitative methods, which are open-ended exploration of themes and experiences, or quantitative methods, measurable, definitive data points, or mixed methods approaches will best serve each of our clients' needs. And then one more differentiator for our firm is connect data to action. We don't just collect and analyze data. We translate findings into strategic recommendations that organizations can actively implement. Now, every assessment we conduct involves meaningful community engagement. We don't just analyze numbers from behind a desk. We bring stakeholders to the table, conduct interviews and with community leaders, and ensure that the voices of those being served are central to our findings. Whether we're working with tribal organizations serving multiple tribal communities or hospital systems addressing diverse urban or rural populations or public health departments tracking complex population health challenges, we ensure that our assessments reflect the real experiences and priorities of community members being served. Now, we combine scientific rigor and deep commitment to health equity. We understand that effective community health assessments require both technical expertise and genuine partnership with communities being served. And our role is to bridge gaps between data collection, interpretation, and meaningful change, ensuring that every assessment leads to action and improves community health outcomes. When your organization partners with us, you're not just getting data analysis, you're getting strategic insight that empowers you to create lasting positive change in the communities you serve. We become your trusted partners in translating complex health data into clear, actionable strategies that align with your mission and amplify your impact. We have some amazing stories of clients that we've worked with. And in the coming few episodes, I'm going to be sharing some of those experiences and stories with you. And you'll get to feel as you listen to me share why this matters so much and really feeding off of the impact that we're able to have and the relationships that we have with our clients and how this keeps us going in some of the most difficult and challenging times of public health. So if you're listening to this and you're a part of an organization, or maybe you know of an organization that's looking for this type of support, then please reach out to us through our website, drchuntley.com. We would be happy to meet with you and explore how we might be able to help support your organization. The links will be provided in the show notes for this episode as well. So I encourage you to do that if any of that resonated with you and it sounds like something that we can support you with. And for everyone else, I hope that if this deep dive maybe gave you something a little different to think about that you hadn't thought about before, I hope so. Now, to find the show notes, visit phecpodcast.com. And once you're there, navigate to episode 413, which is this episode, and you'll find the show notes and the links to click on consulting, leave us a message, and that's how we can set up an appointment with you. Or contact us page, whatever works. Once you're at the website, you'll be able to reach out to us. We would be happy to arrange a time to meet and discuss. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.